QR code, as we will share it again at the end of this seminar. So now we'll go ahead with our forum session. So please welcome Prof. Dr. Rusli as the moderator of this forum, and our speakers will be answering some questions from our fellow participants.
Thank you, Dolicia. And I guess we have slightly about 30 minutes towards the end of this webinar. And we have, I think, still have a list of questions in Slido. What I'll do is that I will look at a question, and then perhaps the remaining participant, because Pro Adiba not here, will be able to answer, okay? The first one, I think, is the question regarding voluntary. This is to Dr. Vicky. The question was on how do we improve on voluntary testing and counseling for HIV patients? Is our community ready for a radical change in facing HIV/AIDS pandemic, the way they respond to COVID-19? So this is a question to Dr. Vicky.
Yeah, okay. How we improve voluntary testing and counseling? I think first we need to address the issue of stigma so that people are not scared to come out. We probably need to promote it more. I think, as the other speakers have said, we should probably use the virtual media more to promote cases, to make it easier for people to come forward for testing. I forgot to mention one more testing service that we offer in Klinik Kesihatan. It's on anonymous testing. For anonymous testing, because the fear of disclosure is there, patients don't have to give any details when they come. They just come to the clinic and say they want to be tested. We will test them without getting any personal data such as name or IC number or anything, and we will just perform the test. If they should be tested as reactive, then we will ask them to proceed to proper testing, in which point we will try to get more information from them. But I think the main thing is to remove the stigma so that people are more ready to come forward.
Okay, thank you, Vicky. And the second question, more about, whether there's any lesson we learned from the current COVID-19, because I think there's a parallel between COVID-19 and HIV/AIDS. Any lesson learned?
I think the lesson would be that we actually can do anything if we really want to. When in desperate circumstances, everything can change. We can change the entire way we run our clinics, the way people respond to threats. So if maybe we have stopped treating AIDS as an emergency because it's been with us for so long. So perhaps using the lessons from COVID now, that we can respond faster, we can do better for HIV as well.
Thank you, Dr. Vicky. The next question, I think, easily for both Dodi, Akmal, and also Prof. Shetty. Maybe I just would like Dodi or Akmal to just take up this issue about, again, stigma, discrimination, that I think is very rampant, and also something that you experience almost on a daily basis. So perhaps Dodi would like to respond to this. How do you eliminate stigma and discrimination? Yeah.
For me, it's like you have to think, even though stigma, and I would say that daily basis we will encounter stigma, discrimination, and so on, even though we do so much thing. So it's actually people need it came from the within of yourself. Actually, people start to change their perspective and so on. Me as an outreach worker, Akmal as an outreach worker also have faced numerous time of stigmatized. Not me, especially I also an open HIV person who's revealed my status, and also as an outreach worker myself, the stigma is like 2 more time, the burden of the stigma and everything. But I think the stigma is because people always constantly think about, when it comes to HIV/AIDS, people will encounter that dua benda ni comes when sexual encounter and so on. So we have to to cut those thinking of HIV datangnya sebabkan sex and so on. And I think by that sexual education from the start, from the from the school days, it really will really help to cut this discrimination and so on lah.
Thanks, Dodi. Akmal, anything Akmal to add to what Dodi have said?
From personally, I think stigma has a lot to do with self-awareness. When you are lacking in of insights about yourself, about how your thought constructs are, that's when your insecurity kind of seeps in into, and you kind of project your insecurity onto others, even though that stigma is actually quite unwarranted, because the message is clear, the science is very clear. You know, people who are living with HIV, they can get treated, you know, they can get their viral load suppressed, and they cannot transmit the virus. So there's no use of having stigma against them, right? So it's more of a internal thing. It's more on self-awareness, I think. If we can be more self-aware of how we construct our thoughts about someone else, you know, we can help lessen the stigma. Yep.
I just want to add one more, Akmal and Dodi, before I go to Prof. Shati, you know. Coming to the specific discrimination or stigma, for example, from the religious angle, or from, you know, people tend to preach, people tend to you said the word condescending, using all these pejorative terms, you know, and perhaps the greatest one that I think we are worried about, that it comes from even professional, you know, who should be the one that should be advocating for a clearer and more positive response to the HIV/AIDS situation. So again, your view, you know, because you are facing this, I said clearly from many angles, because of the conservatism in our society, you know, and then so what is the way out, you think? So is that one through just education alone, that you know, like the work done by class and many other NGO? What do you think is the way forward, no? So that one day there will be none of this, that we will have a society where people are very positive, very open, very accepting, and not, you know, judgmental or even preaching and so on. What do you think?
For me, it's like I said, you know, when it comes to religious and so on, like one of the outreach workers stigmatized or challenge that we have to face when it comes to religious terms and so on, where, you know, like what Mr. Akmal shared during his session, we had to, as an outreach worker, we had to give out a handout of condoms and free lubricants towards the risky people. I consistently, and most of us consistently deal with people saying that we are trying to encourage, you know, sex more often and so on. For me, it's like, whether we hand out or whether we didn't hand out condoms and so on, whether whether people can buy by themselves the condoms and the lubricant and so on, sex still happens. It doesn't mean that we give out, hand out, kita orang bagi condoms, doesn't mean that we are encouraged. No. But for me is people like Akmal, Mr. Akmal said, it's actually self-awareness lah. You have to be more open, and you have to be, you know, think outside of the box. You know, the main thing is that we are trying to help people. We are not trying to encourage people to do such, you know, things yang jahat ke whatsoever and on. And then collaboration with also, I think, and instead of, you know, we said, like, we want NGOs to collaborate with medicals, with professors, with the medical staff and so on. Maybe we could collaborate with the religious staff also, where we could give out sexual education towards, in maybe in surah or mosque or anything, you know, just to cut those barriers of the stigma and everything towards the inside the religious term lah.
Thanks, Dodi. Thanks, Akmal. I think you are very brave, and, you know, and we appreciate you for sharing. And we are also emboldened to know that many of you are very open about your views on this. So let's move to South Africa. Prof. Shati, looking at your presentation on children in South Africa, those affected by HIV/AIDS. So again, on the same vein that I posed to Akmal and Dodi, what are your views, Prof. Shati, on this issue?
Good morning, or should I say good afternoon to everyone. You know, in South Africa, we're 6 hours behind you, so it's still bright and it's still the morning here. Thank you for inviting me. I must say thank you, because I didn't get the opportunity to say. I'm just driving back to my province right now, but thank you so much for inviting. inviting me and allowing me to share my children. I must say that in South Africa, like in every other country, the stigma is multi-level. So stigma from families, communities, and again, MSMs, the LGBTQI community experience stigma still today from healthcare professionals, communities, and lots of organizations. And in terms of children, there's added stigma that comes from peer. So we have comprehensive education programs. We are targeting stigma related to HIV on various levels. We're targeting the education system from primary to secondary schools. This is why we introduce these children's series of books, and we have workshops, roadshows. But, you know, I think I discussed this with you, Doctor, that access is still a huge problem for us in South Africa. So we have all these extensive and comprehensive programs, but then access becomes an issue because we literally cannot physically access a lot of children. And in South Africa, I'm sure you're well aware that the socioeconomic status is directly proportional to HIV infection. So we are now challenged with the poorest of the poor people in South Africa who are there's increased infection amongst them. And then we have access because we cannot get into some of those resource constrained areas. So it gives us, there's multi-level challenges for us as advocates, researchers, scientists, people who really want the science to become implementation science, because like I alluded to in my presentation, it's difficult for us to continue with the science without addressing such a burden amongst the people in South Africa.
Professor, thank you very much. And I just would like to ask you, because based on what Dr. Vicky has presented on the experience in Malaysia in terms of the testing and then, post-testing, care, engagement, and so on, is there a similar development in South Africa? Is it, what do you think? Is it comparison to Malaysia, what our experience in Malaysia is in terms of engaging people with HIV, and the subsequent treatment,
Sorry,
care, and so on? Yeah.
I'm so sorry, you broke up a little bit, but
okay.
It is very similar to what...
Go on, yeah.
Yes, it is very similar. We have similar challenges. I think if you just look at it proportionally, it's just on a larger scale. And but we are faced with exactly the same issues, the same challenges. And the big problem for us is because of the stigma and the poor disclosure, people are not coming forward for treatment and for prevention strategies. And that's what we need to address. And lots of the times we do, I mean, we have the medical care in South Africa, we've got a large comprehensive ART program. We have excellent access, and South Africa is funding a lot of their own medical care. But the issue again is stigma. I also chatted with you earlier this week about the fact that we go into some of our communities and we find that patients are hiding their treatment, they're burying them, they're selling it for drug use by other community members. And that's just because they don't want anyone to know that they are on ARTs, and they don't want people to know their status. And that is also, there's a further burden because of the cultural nuances in our country, because certain groups believe that it's a spiritual position or oppression, and that becomes an issue because people don't want to socialize with people with HIV. And we often find that HIV leads to disability using a biopsychosocial framework, and they further stigmatize now because of the disabling effects of antiretroviral therapy and then the HIV, and that's the challenge we faced with.
Thanks, Professor. I can see that you're driving in it. Keep safe while driving. I'm a bit worried. You're driving on the road and also responding to us. Thank you very much. The other thing, this is regarding this the use of sexualized drugs like crystalline meth. And I think I want to address this to Dodi and Akmal again, back to Akmal and Dodi, regarding these two drugs. Sorry, regarding this crystalline meth and in terms of the implication for, because the question whether we need to legalize the drug, just like marijuana now, see there's somebody got in trouble when we become legalized. So what is the thing now in Malaysia, the way forward, Akmal and Dodi, because it seems that people are using this quite on a big scale, no? In terms of group sex and so on. Maybe Akmal or Dodi?
I will direct this question to Mr. Akmal,
Okay.
since he's very much expert when it comes to math and so on.
Okay. Akmal?
Yeah.
Okay, I think previously I went to this talk from people who used to engage in chemsex, and there is a study done by Dr. Howie Lim, if I'm not mistaken, on why these people seek out these risky activities, which is sexualized drug use. It was actually due to loneliness, as well as sensation seeking and all those things. So, just like all addictions, it is actually related to mental health. So I think part of it is because the community, the key populations are very marginalized, right? They are always in survival mode, and then they cannot be true to themselves in public and all those things. So I think it actually affected their mental health a lot, and due to maladaptive coping mechanism, that's why they actually engage in chemsex. And yeah, so I think if we can address mental health specifically for the key populations, maybe like what we are having right now uh, with our Hercules program, which is a mental health and nutritional clinic that we held in our office in Kelas Sentul. So maybe we can reach out to these people. Maybe we can help them address their relational issues, any mental health issues. That's one thing. And then another thing, to prevent risk of HIV transmission is to actually tell them the options available for them. Because people who engage in chemsex, they do not prefer to use condoms because, as what they say, because the crystal meth makes them very sensitive. So they became sensitive to the latex, to the condom, so they don't want to use it. So what are the options available for them? So this actually circles back to the no wrong door approach, whereby they can use PrEP, to actually prevent HIV. But of course, PrEP only protect them against HIV. But then other STIs are actually quite curable. So yeah, as long as they are on PrEP, I think they should be fine. The HIV transmission risk should be minimized, and we can address their mental health issues as well at the same time. Yeah, that's, I think, one of the ways we can address this issue.
Thanks, Akmal, but thanks very much for that revelation.
No
Dr.
problem.
Vicky, I would like to ask you this question. This is a $1 million question, no? Somebody's asking about when you begin HIV treatment, how long does it take for the risk of the sexual transmission of HIV to become effectively zero? No? I like the word zero. Any advice on that, Dr. Vicky?
That's like a bit of a lottery question. But generally, we know once you start HIV treatment and you go on it properly, you should be able to reduce your viral load to undetectable after about 6 to 12 months of being on therapy. So we would hope that after a year or so, you would be undetectable. And then if you stay undetectable, then effectively transmission is less. But having said that, that's where we need you to come back for your follow-up for us to keep testing the viral load, because some people do take longer to become undetectable. So it's a bit hard to say, but I suppose in general, more than about a year.
About a year, yeah, that's good. That's a good target to achieve in a year, yeah. Yeah, so just timekeeping. Dodi, maybe now I push it to Dodi. This is something like, sharing from your experience in terms of that doctors, may perhaps healthcare practitioners can also learn from your experience. So the question is, how can, I mean, the engagement of people living with HIV, how can the patient feel comfortable, as it were, speaking to on these sensitive issues, especially in the environment of clinic, doctors, nurses, and other healthcare practitioners. So what are your own experience and advice?
Okay, personally for me, it's like one first thing that you guys should think is like I always think that when it comes to your work, you have to be professional. So when you have this information on you have this PNC towards yourself, where the client's information and so on. So you have to keep to yourself. I mean, within the doctors or maybe inside in the room with the nurses and so on. Never bring those information out. Always come back to the professionalism. And one more thing that some of the clients encountered, we do have complaints or reports from clients saying that when they want to do tests, the doctors will say like, kenapa you buat sex? This thing against the religion and so on. It's like they are blaming back to the client. So those thinking or the way you approach it, for me, it's not quite suitable. So you always think that it's not their fault or anything. Things happens. Whether like I said, whether they know about HIV or didn't know about HIV, sex happens. It's a human nature. You cannot like literally salahkan everyone like, oh, you buat sex and you langgar agama and so on. You have to be more like I said, more open and more friendly approach. Like never blame the client and itself, because these are actually one of the cases or reports or the complaints that we have from the clients. That is why they are scared to go to the hospital clinics. They tend to come to our CBT's testing. So yeah.
Thanks, Dodi. Perhaps Dr. Vicky may present the idea around from the doctor's point. How do you advise, Dr. Vicky, on this?
Okay. Actually, what Dodi said, what the question says, how does the doctor make the patient feel comfortable speaking on these sensitive areas? We can actually turn it around, and how does the patient make the doctor feel comfortable as well? Because these are sensitive areas, talking about sexual habits and practices and preferences. And doctors are also human, so some of us may find it very difficult to talk about these topics comfortably, because yes, we are from a conservative society. What I do find is that the more the doctors see, the more patients doctors see, the more comfortable they become. Because I have specialist training under me, and I always see the difference from the first weeks when they sit with me to see patients. They feel a bit awkward about asking these questions about the patients. Not that they're trying to be stable, they need to know so that we can advise properly. But by the time they finish their 6 months or a year with me, they're all very comfortable with the patients, and you can see the patients also becoming more comfortable. So I guess the doctor themselves have to realize what their feelings are and overcome those feelings. But secondly is that, yes, no doctor should be judgmental to the patients. A disease is a disease, and we're supposed to treat them professionally, non-judgmentally and professionally. Whatever brought the patient to us is a different story. It's our job to make them feel comfortable and make them and solve their problems and help them to stay with us and go on with treatment.
Thanks, Dr. Vicky. And there's another question for you, Dr. Vicky, regarding PrEP, PrEP in your clinics, and then question of how frequent treatment and so on. There's somebody here has been asking this. Do you have any advice on this?
Yeah. Okay. PrEP is not given free to patients under the Ministry of Health. It's not part of our regular management as unlike HIV treatment per se. We don't prescribe that much of PrEP in the clinic because I think patients probably have a stigma about coming to us and asking about PrEP. But if the patients do come and ask, we first remind them that they have to be sure that they're not positive when they want to start on PrEP, because they may be in the window period, and that will be dangerous because if they start PrEP is a single drug. If they take only the drug, then they may develop resistance. If they can be tested properly to make sure they are not positive, then we would give them a prescription to get the PrEP outside. We would still have to remind them that just like HIV treatment, you have to take PrEP properly. You can't just feel like taking it and then don't feel like taking. You need to take it regularly. You need to be monitored because it may have side effects. So you do need to come back for other blood tests. And you need to remember that it only prevents you against HIV. It does not protect against other STIs. As Ahmad said, other STIs are treatable. but you still don't want to get those, and it doesn't protect against hepatitis B or hepatitis C as well.
And last two questions to Vicky again to you, regarding art and stem cell transplant.
Oh.
Any advice regarding? Because they're asking was how good is this ART treatment currently out there, and in terms of future, anything about any possibility of stem cell transplant to be used in HIV treatment?
Well, art treatment is excellent. As I said, the difference between before and now, it's easy, it's free, it's simple. So, and it's easily available. So, and it's effective. It is definitely effective. Patients who go on art therapy, take it properly as prescribed and not missing the tablets, they do get virally suppressed and they stay virally suppressed for so long. So much so that the patients who come back to me now for their regular follow-ups, the consultation is so short because there's nothing to ask them, they're fine. They just need to take their medications. It's not, I don't think it's stem cell transplant that the people who got cured were given. I believe talking about the Berlin patient who had, I think it was leukemia and had to have a bone marrow transplant, and then they gave him a transplant from someone who had a certain type of cells which protected him against HIV. So stem cell transplant, as far as I know, is not being used widely, not being used at all. But I'm sorry, I can't tell you very much about what the prospects for it are, because it's not my field.
That's okay. But the very last question at the top, very top, was about homosexuality and future of homosexuality and HIV in Malaysia. Somebody has written that. I can pass it to perhaps again to maybe Dodi or Akmal, or maybe Dodi wants it, Akmal.
Yeah. I'll try to answer this one. What was the question again?
The question was the future, no? Somebody said he's homosexual and he may have also HIV. So what's the future for this in Malaysia, no? And for people being homosexual and having HIV.
Okay. I think the future for people who are homosexual as well as having HIV is much like everyone else, really, because it is treatable, the science is there again, yeah, you just need to adhere to the treatment. And then when you reach undetectable, you are basically just like everyone else. You cannot transmit the virus. You can live your life healthily, just like everyone else. So about homosexuality and HIV status, I think some of us prefer not to disclose our status, prefer to be like incognito. So I think how do you say? Because we are an Islamic country, we are very conservative. I don't think LGBT will be accepted in any time soon. But at the same time, you don't. Doesn't matter if you don't agree with LGBT or all those things. We can always agree to disagree. But at the same time, don't let that make you see these people as less than other human beings. They're still people, they are still human with the same rights. So treat them equally. If let's say you encounter someone who is homosexual or living with HIV, I think an advice that you can use is the insight that was shared to me from Mr. Andrew. Put yourself in this situation whereby that person is actually your family member. So what would you like to say to maybe your son, maybe your brother, who's actually homosexual, who came out to you being homosexual, or maybe even have HIV? So what would you say to them? Would you cast them aside? Would you say bad things to them? Would you like rob their future away? No, right? So treat them as one of your own. Don't see them less than a human, because we all are different. We all have different lifestyle, different beliefs, and different everyone is basically unique. So try to embrace that. Yeah.
Thank you, Akmal. I think with that, wrap up from you, actually, it is almost like, it almost wrap up the whole of the this webinar. I'm glad that, that we still have space for very open-mindedness in the society. So I guess the future is clear, that we do the best we can, right, with what we have, and let engage one another. For those of us who are bent on advocacy about HIV/AIDS Malaysia, so that we have a bright future for all citizens, all people in Malaysia. So with that, I think I will like to just come to a close. Like again, one more to thank all the speakers, Prof. Adiba, Prof. Shati, Dodi, Akmal, and Dr. Vicky, for a very, very excellent presentation and thought-provoking, and despite the sensitivity and so on. So we thank you very much, and I would like to take the opportunity to everyone to thank all of you for this important discourse on living with HIV/AIDS in the era of COVID-19. So the last I would like to say is just to thank all the organization involved for making this webinar possible. To thank the people, organizing committee, especially Dr. Priya, Dr. Suyin, Dr. Sapna, Pen Yvonne, Alentino, who else I must say? Dolicia, and who else I miss, and so on. And again, last but not least, to all the participants and the audience who have kindly posited many of the questions, thought-provoking questions that you all share. And I hope that this sharing can be used later on for many purposes. Like those from academia would like to do some research, like as mentioned, we should take advantage of this, do some more research and more data to support our cause. So with that, I would like to thank everyone. I'm passing back this webinar back to Dolicia. Thank you very much.